Good morning.
Good morning, ma'am.
Good morning, ma'am.
मेरी आवाज आ रही है ना?
Yes, ma'am.
ओके, चलो हम लोग सेशन स्टार्ट करते हैं. सो कल हम लोगों ने देखा क्लिनिकल फीचर्स एंड डायग्नोसिस कि हाउ वी विल डायग्नोस द ट्यूबरकुलोसिस, राइट? सो आज हम लोग आगे का पार्ट देखेंगे, द कॉम्प्लिकेशंस एंड द मैनेजमेंट पार्ट. So tuberculosis, as you know, कि ये this is a airborne infectious disease. Okay, it can tuberculosis can happen from one person to the another person. So there are multiple complications of the tuberculosis. So even now in the COVID-19, even the COVID has one of the complications of tuberculosis. So in many patients of COVID, it is seen that the person's having a low immunity, right? So because of that, persons may suffer from the tuberculosis or even the pneumonia. So there are very high chances of tuberculosis and the pneumonia. So what are the different complications of tuberculosis? So there is one complications is bone pain or the spinal pain or the joint destruction. It may result from the TB that infected your bone. So first is primary. You can see the pulmonary tuberculosis which happen in the lung, but it can spread from one lung to the another lung, and then it can spread throughout your body. So it can go to your abdominal region, stomach region. It can spread to your bone, even to the brain, even to the liver, even to the kidney, even to the heart. Okay, so it causes even the meningitis if it spread to the brain. It's even affected the liver and the kidney, cardiac tamponade, so it can affect the heart also, the pleural effusion, and the TB pneumonia. So pneumonia is very common in tuberculosis. Okay, so if the person is suffering from the tuberculosis, persons may develop the pneumonia very easily. Okay, and other complications is the reaction to the drug therapy. ये हम लोग आगे देखेंगे what is exactly the reaction to the drug therapy. Okay, so these are mainly the complications, and last but not least the complications is the death. Pulmonary, it's the cure rate is 50% and the death rate is 50% in case of the TB if not properly treated. So what are the management and the treatment? Main aim for the tuberculosis is to prevention, education, decrease the transmission of the TB to the other, prevent the complication, monitor of the side effect, proper nutritional diet, and we have to prevent the relapse. Right. So prevention, when we called as the prevention, we all know we have the some or the other tuberculosis element in our lung. But if our immunity is good, okay, so that latent tuberculosis cannot turn into the active tuberculosis. So we have to maintain our immunity is the main preventive action. Education, we should know about the tuberculosis, so even the patient, if any patients come to you regarding the tuberculosis, if the patient having the tuberculosis, the family should be aware of कि what is exactly the tuberculosis and how it happened, how its reaction, because there are multiple drugs when we indicated in case of the tuberculosis. So their hazardous reaction occur, their adverse effect occur. So the education is very important. Okay. And if the education and proper prevention has taken, we can prevent the complications with a nutritional diet, and we have to stop the relapse. Okay, so prevent the relapse is one of the aim of the management, because in case of the tuberculosis, if the person's having a tuberculosis once, it may chances कि वो again हो सकता है. Okay, so what are the different preventive measure? Okay, before the management we will see the preventive measure. कि what are the different preventive measures which we should take? So mask, use the personal respiratory protective device, avoid exposing yourself to the people with the active TB, BCG vaccine, regular medical follow-up, isolation of the patient, ventilation is very important, natural sunlight, and the UV germicidal radiation. So personal hygiene is very important. The healthy lifestyle and environment, and the immunization. Immunization is the BCG vaccine. Healthy lifestyle and environment money, in a clean environment, in a clean house, in a proper diet, not the junk food, and the personal hygiene. These are the main tuberculosis prevention. There are 5 steps you can prevent the TB transmission. First is screen, second is educate, third is separate, fourth is provide the HIV service, and fifth is investigation for the TB. So first, when we called as the screen, so early recognition of the person with a suspected of the confirmed TB. Okay, so screening is very important if you want to prevent the TB transmission. Education, so screening माने if any like अगर grandfather had a disease of tuberculosis, okay, it may chances son may suffer from the tuberculosis, so you have to screen that patient. Okay. Uh, Even if the HIV persons or any pneumonia persons or anyone having a immunocompromise like cancers patient, so you have to educate them. Okay, that they may get suffer from the tuberculosis, so before getting the tuberculosis they can prevent that. Okay, so prevention is very important. So educate, so we can instruct the patient on cough on hygiene when sneezing or coughing, provide the tissue or mask using the mask and the proper hygiene. Separate, request the patient to wait in a separate and well ventilated area so that other persons cannot be suffered. HIV service. So it's a symptomatic patient to front line for a service sort. So they spend a minimal time around other patient. Okay, and investigations for the TB. हम लोगों ने investigations देखे हैं, diagnosis, sputum smear, even tuberculin test, chest X-ray, so that हम लोग अगर early diagnosis कर पाए tuberculosis का, then it cannot spread from the pulmonary area to the other area. Okay, so prevention is very important in case of the tuberculosis. One of the prevention is BCG vaccine. Okay, so what is BCG vaccine? BCG vaccine is Bacilli calmette guerin. Okay, so it is first used in the 1921. Right now also it is the only vaccine available today for the protection against the tuberculosis. It is most effective in protecting the children from the disease. Okay, so BCG vaccine is given in a childhood only. So it gives zero point 0.1 ml intradermally. Duration of protection is generally 15 to 20 years. Effective is up to 80%, and it should be given to all healthy infant as soon as possible after the birth, unless the child presented with a symptomatic HIV infection. If the person's having the HIV infection, we generally not give the BCG vaccine. But right now also, if the person's having a tuberculosis, okay, while screening and while treatment, if you ever find out ki person's having a tuberculosis and we ask the history, okay, history taking is very much important. When we ask the history, and in a history if you able to understand कि person ने BCG vaccine नहीं ली है, okay, then there are the center or there are the different center where they give the BCG vaccines to that persons so that the protection occur. Okay, चाइल्डहुड में जो बीसीजी वैक्सीन देते हैं दे कॉजेज द प्रोटेक्शन अप टू द 50 to 20 years. ओके, उसके बाद रिपीट करने की जरूरत नहीं पड़ती है. बट इफ द पर्सन इज नॉट इम्यूनाइज we have to give him the BCG vaccine. Okay, so there are different center, as I say. So that center you heard about dot center. Okay, so in a dot center they give directly observed treatment or the short course. Okay, dot means that a trained health care worker or other design individual provided the prescribed TB drug and watches the patient swallow every day. Okay, वहाँ पे जो हेल्थ वर्कर रहते हैं, हेल्थ वर्कर मतलब नॉट ओनली डॉक्टर्स. ओके, द trained the trained healthcare worker. Okay, so any persons can be trained by under the doctor or uh, under the nurse. They are the trained health worker. Okay, there are different dot centers in India also. Okay, so for the TB cases, so that dot centers healthcare worker sure that की person उनके सामने ही medicines ले, because there are many incidents occur where पेशेंट को अगर मेडिसिन प्रिस्क्राइब कर दी, ओके, उसके बाद भी पेशेंट लेता नहीं है. सो इन टीबी केसेस इट्स अ इन्फेक्शियस डिसीज, राइट. सो अगर पर्सन प्रॉपर कोर्स नहीं ले रहा है टीबी का, तो दैट पर्सन कैन कॉज द टीबी इन्फेक्शन टू द अदर पर्सन. Okay, so it's very important. That's why in different area, even in the India or even in the world, the dot centers has designed. So we, other than that prevention, we give the anti-tubercular treatment. So anti-tubercular treatment, it must be started in time, so early phase of the disease. So treatment must be long and the continuous. There is complex method of the anti-tuberculosis treatment must be given. There is combination of anti-tubercular medicines. Treatment must be observed. That's why the dot centers are there. Course of the treatment must be without the interval and treatment must be individual. So the course of the treatment of the tuberculosis is long. Okay, so if the person is stop taking medicines in between, it happened in India. Okay, so what happened कि persons having a course of like 4 month का अगर कोर्स होगा, पेशेंट को 2 month में ठीक लगने लगा, पेशेंट मेडिसिन बंद कर देता है. अगेन जो माइकोबैक्टीरियम ट्यूबरकुलर बैसिला रहते हैं वो एक्टिवेट होते हैं एंड द रिलैप्स आकर. दैट्स व्हाई इन इंडिया द रिलैप्स इट्स वेरी प्रोमिनेंट. ओके, सो दैट्स व्हाई दैट डॉट सेंटर के जो हेल्थ वर्कर रहते हैं दे क्लैरिफाई कि पेशेंट बराबर आए एंड बराबर ट्रीटमेंट लो. ओके, ये समझ में आ रहा है? हेलो.
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Good. So these are the main principle of anti-tuberculosis treatment. Okay, so what are different treatment? So in India, the standardized treatment regimen for the MDR TB, it's 6 drug regimen. Okay, this is an intensive phase of 6 to 9 months and a continuation phase of 18 months. Okay, so that MDR TB is a 6 drug combination. Okay, so we given for the phase of 6 to 9 months and it can continue to the 18 months. So total duration of the treatment is 24 to 27th month. Okay, what is the 6 drugs? That 6 drugs we give the patient in a combination. Okay, not a alone. Because अगर एक दे देते हैं medicines, like these are the medicines. Okay, these are the 6 main drugs in India we give. So every dot centers have that 6 medicines. So if you are diagnosed with a tuberculosis, you have to take that 6 medicines with a duration of the 24 to 27th month. Okay, so kanamycin, levofloxacin, cycloserines, ethionamide, pyrazinamide, and the ethambutol. Okay, these are the 6 drugs. Basically, nowadays in India we give in a combination, because if we give only a one dose, one drug, okay, so if we give the kanamycin, okay, so the drug resistance has occurred. So in our body they get immunized and drug resistance occurs. So patient, that mycobacterium tuberculosis is very effective to resist these drugs. So we have to give in the combination. So there are the different classification of the drug. So first line drug, second line drug, and the third line drug. Okay. So there are three classification. What is the first line drug? So first line drug is rifamines and the ionized. Okay. So it's the most effective drug for the treatment of the TB. Okay. So these two drugs never indicated alone. They are always used in the combination because resistance occur to the one drug alone very rapidly. So as I said कि resistance बहुत जल्दी आ जाता है in case of the Mycobacterium tuberculosis infection. So these are the first line drug. What is the second line drug and when that indicated? So second line drug is not effective and have more toxicity. Okay, so when the first line drug has causes a resistance, we indicated basically the second line drug. So streptomycin is the one of the second line drug. There are the other drug also, but main is the streptomycin. So it's a first drug used clinically for the treatment of the TB, duration of the 1947 to 1952, and it's the only drug available at that time. Okay, now it's multiple drug has been indicated as a second line drug, but initially streptomycin is the only drug, and it is an aminoglycoside antibiotic. Okay, and the third line drug, it's the least effective and most toxicity. Okay, so these are the third line drug: amikacin, kanamycin, capreomycin, and viomycin. So third line drug are used when resistance is developed to the first and the second line drug, and these drugs are also used in the combination. Every drug in the tuberculosis, so these six drugs are very important. Okay, nowadays we indicated these six drugs. Okay, in a duration of the 24 to 27 month. So these all six drugs we used in a combination only. Okay, so even the first drug, second drug, third line drug, we indicated in a complication combination. But these drugs have causes a more toxicity and the complications, the adverse effect, because the Mycobacterium tuberculosis bacilli are very strong that they causes resistance, and our body causes resistance to that drug, and they causes a certain adverse effect. Okay, so these are the treatment regimen according to WHO. So what is drug resistance TB? Okay, so in 2018, so Apeksha, Apeksha, mute yourself. Yeah. So in 2018, an estimated 500,000 cases of tuberculosis were reported. Okay, so only 1 in 3 people with MDR TB were started on the treatment. So, like you can say, 95 to 98% persons having started with a TB treatment. So, 56 to 39% of the people with treatment for MDR TB and XDR TB respectively. Okay, so pulmonary and the extrapulmonary TB. So, were successfully cured. There are 3 countries accounted for half of the world cases of MDR TB. So India is 27%, China is 40%, and other is the 9%. So there are one survey where they done so 1.47 L cases of MDR TB. What is MDR means? Multi-drug resistance TB. Okay, so in India, it's around 147 people are suffering from multi-drug resistance tuberculosis. Okay, and around 30,000 people of all MDR TB patient have resistance to the drug and are eligible to receive the other different TB program. So till now they occur as different type of the medicines they choose. Okay, and they experience ki uh, as a treatment purpose what should have to give and what should not to give. Okay, so So the TB treatment success rate in India is 46% and the death rate from the TB in India is 20%. Okay. So drug resistance is caused by, it may caused by the incorrect prescription. So if we have, firstly we indicated to the first line drug. Okay, so if we indicated the second line drug first, so toxicity first occur and persons already get resistant. So if the incorrect prescription occur, so that may get the chances of the drug resistance. Okay, even poor quality of the drug. So in a village or in a Adivasi area where people don't have much money, or even the government has provided them the drug, but if the drug is of a poor quality drug, so it can cause the resistance. Okay, and even the immunity of the persons, if the persons is immunized to that particular drug, the drug resistance has occurred. Okay, so that drug resistance of the TB is very common. Okay, ये समझ में आया ड्रग रेजिस्टेंस टीबी?
Yes, ma'am.
Okay. So when we called as drug resistance TB, their adverse effect. Okay, when I'm saying the adverse effect, even the first line drug, even the second line drug, even the third line drug, or that six combination of the drug, they causes a adverse effect. So what are the adverse effect they cause? So GI irritation. So anorexia, nausea, vomiting, peptic ulcer, abdominal pain, etc. they causes. Hypersensitivity reaction like rash, fever, skin eruption. Nephrotoxic, so proteinuria, hematuria, electrolyte disturbances, and it affect the auditory and the vestibular function also. So they affected the cranial nerve also. So cranial nerve, auditory and the vestibular, and they affect their function. CNS disturbances, they causes the headache, confusion, vertigo, tremors, paranoid, and the difference reaction. So patient may get, you get the CNS affection, patient may get confusion, patient get headache, patient get vertigo. So in many time what happened now, when these type of the symptoms patients are showing, patients stop taking medicines. Okay, and when patient gets stop taking medicines, the mycobacterium tuberculosis get another other active, and they causes again a tuberculosis. So then however that effect is reversible when the drug is stopped. So when you stop taking the drug, these all the whatever the effect has occurred, they get stopped. Okay, but sometime there is the nerve damage is permanent. So if there is the auditory and the vestibular nerve has damage, that nerve damage is permanent, but other these symptoms are temporary. So other these symptoms, when we taking the drug, these symptoms can be shown, but after that, that reaction will be stopped. Another option apart from the medicines, okay, there is the surgery option. Okay, these are the nationalized TB treatment program. Okay, so what I'm telling you about the first line drug, second line drug, third line drug, even in the chemotherapy when they give to the tuberculosis, same drug they used. Okay, these are the nationalized TB program. So when the person is suffering from tuberculosis from the world, any persons, they indicate the same medicines. Okay, but apart from the tuberculosis drug, there is one option, that the surgery. Okay, so surgery is less indicated in the tuberculosis. So for example, if the person's having a tuberculosis at a particular area, that the alveoli or the in a lower lobe of the lung, and it not spread, so you can recommend the partial lung resection, that is the lobectomy or the wedge resection. Okay, obviously with the medication, but if that gets spread to the other lung, and if that gets spread to the other part of the body, and mycobacterium tuberculosis multiply very rapidly, so the surgery options we do not indicate it. Second reason is not indication, cost. It's very costly surgery, lobectomy or the wedge resection. And after the surgery also, it may possible the persons get the relapse of tuberculosis. So generally we not indicated the surgery, we only uh, treat the persons with a medications. But if the surgery has recommended it, we do the lobectomy and the wedge resection. So lobectomy, where one of the lobe is removed, okay, so it can prevent the spread from a TB to the other lobe. So basically, better recovery of the tuberculosis, very essential the follow up. Okay, so after the 27th month तक जो कोर्स किया है मेडिसिन का, उसके बाद भी persons need a multiple follow up. Okay, because I said कि relapse has a relapse tuberculosis में बहुत ज़्यादा होता है. If not tuberculosis, persons may go into the pleural effusion, persons may having pneumonia. So lung infection easily occurred in case of the tuberculosis condition. So in a better recovery of the tuberculosis, so regular treatment and the medications is very important. So compliance and the regular treatment, okay, adequate rest, balanced diet, adequate exercise, and the fresh air. Fresh air means ventilation. So ventilation should be proper, balanced diet should be proper, adequate rest, and you should protect yourself. Especially the healthcare worker, the doctors who has a less immunity, they can be diagnosed with the tuberculosis if they get into the one of the patient of tuberculosis. So it should necessary to take the precaution. Yes, yes, AKT4 medicines भी use करते हैं. Apeksha is asking that AKT4 medicines has been used or not. Yes, yes, it has been used. So in every year क्या हो रहा है ना अभी कि एक एक का अगर ड्रग रेजिस्टेंस आ जाता है एक मेडिसिन का, राइट, एलोपैथिक मेडिसिन का, सो दे ट्राई टू फाइंड आउट द अदर कॉम्बिनेशंस, राइट, सो दे आर ट्राई टू फाइंड आउट द डिफरेंट कॉम्बिनेशंस ऑफ द ट्रीटमेंट so that they can prevent the growth of the that microorganism. Okay, so there are different medicines they use. When you called as the AKT में कौन से medicines होते हैं, that same medicines they used. So isoniazid, rimafene and ethanobutal and the pyrazinamide. These are the four medicines they usually used in the AKT. These are our the first line medicine, first line treatment, first line drug. Okay, so generally they start with the AKT medicines. So AKT medicines we called as the first line drug. Same, rimafene and the isoniazid. Okay, Apeksha?
Yes, ma'am.
Yeah. So prevention is very important. So even as a doctor, you should take care of yourself when you are treating any patient of pneumonia, any patient of tuberculosis, or any patients of pleural effusion, because that persons can be uh, further can be diagnosed as a tuberculosis. So that better recovery of the tuberculosis, the prevention is very necessary, and other is the these part, the ventilation, adequate rest, and the balanced diet. Any question? समझा है सबको?
मैम,
या
AKT ड्रग क्या होता है?
अभी पता है ना, AKT ड्रग इज द जैसे पैरासिटामोल होता है. ओके, पैरासिटामोल में कंटेन अलग रहते हैं, राइट. जैसे AKT ड्रग्स में कंटेन जो होते हैं वो फर्स्ट लाइन ड्रग होते हैं. सो इट कंटेन द आइसोनाइजाइड, रामाफिसिन, इथामाबुटोल एंड द पैराजिनामाइड. इट्स अ फर्स्ट डिग्री ड्रग. ओके,
XDR और MDR. हाँ हाँ मैम. मैम, XDR और MDR टीबी का कॉज सेम रहेगा क्या?
Look, MDR is the ये क्या MDR is the drug resistancy. Okay, so उसका cause same हो सकता है because of persons having the resistance towards a TB. Okay, and XDR is the extensive drug resistance TB. Okay, so जो multiple drug हम लोग देते हैं उसकी वजह से जो resistance आता है, that is the XDR. So generally that causes are the same. Okay, because of the drug only that causes a MDR and the XDR. Okay.
या मैम। और मैम वो एक स्लाइड थी उसमें ऐसा लिखा था कि मतलब कुछ था उसमें J&J, वो कौन सी जगह थी वो, उसमें था कि टीबी का वो एक्सपायर हो जाएगा 2020 ऐसा कुछ था 23 में, इसके पीछे वाली स्लाइड में।
Yeah. So J&J जो है ना, so they design a program. Generally, the US government has designed a program, okay, and that will expire on the July 23. जो drug हम लोगों ने देखे ना अब तक, okay, they are designed by the nationalized WHO, okay. So as a WHO, they design a program as a J&J, okay, and it will expire in the 2020. So according to them, uh, they have said the protection towards the successive rate in India is 46%, okay, and death rate is 20%. These are the WHO case programs. So J&J is the granted one program of WHO only, okay, and they said कि it will expire in a जुलाई 2023. उनका जो प्रोग्राम है वो 2023 में एक्सपायर्ड होने वाला है, एंड लेटर ऑन दे अगेन सी कि विच टाइप ऑफ द ड्रग इज मोर इफेक्टिव और अनदर ड्रग दे हैव टू प्रिस्क्राइब और नॉट. Okay.
ओके मैम, थैंक्स।
Yeah.
हेलो मैम।
Yeah.
मैम वो ट्रीटमेंट देते हैं तो 6 to 9 मंथ कंटिन्यू करते हैं ना?
Yes.
मतलब हाँ, तो मैम अभी सपोज पेशेंट है, उसको अभी स्ट्रेप्टोमाइसिन या AKT जो भी चल रहा है, तो मैम 9 मंथ से भी ज्यादा हो तो?
नहीं समझ में आया मुझे क्वेश्चन. 9 मंथ से ज्यादा हो तो मतलब
कंटिन्यू ट्रीटमेंट चल रहा है उसको, वही सपोज अभी पेशेंट AKT ले रहा है ड्रग, तो अभी 10 मंथ हो गए, लेकिन
Okay.
ट्रीटमेंट 9 मंथ तो देते हैं ना,
Look, it is
फिर
depend
भी
on.
मैम तो रिकवर ऐसे मतलब
Look,
पूछ
it
रहे
is
हैं क्या?
it is treatment on the individual basis. Okay, so the same drug has indicated to the every persons, but depending on the person immunity and person's infection, they give the type of the treatment. So if we give the first line treatment, you called as the AKT. Okay, so
Yes,
that intensive program I said 6 to 9 months or about it can continuation to the 18 months. So if the infection has, if the person's having a 9 month treatment, okay, so properly 9 month treatment liya hai, and since then also if after doing a x-ray or after doing the any other further investigations and you see the mycobacterium tuberculosis still get active, you can जो treatment program है वो बढ़ाते हैं, they give it to the 24 to 27th month also.
अच्छा,
Hmm.
ओके मैम।
So it depend on the individual infection and individual immunity. Okay, so after the 9 month, if look, generally program is intensive phase of 6 to 9 months. So in a 6 to 9 month, if the primary phase the infection has reduced, okay, so you don't need to give the treatment. You only need to tell the patient about the preventive measures, that what should you take a preventive measures, that's it. But if after the treatment also 9 months you do the x-ray and the tuberculin test, but if the infection is still there and it gave chances to the spread to the other body, so that duration of the treatment has been increased. Okay, Apeksha?
ओके मैम।
Yeah.
मैम और सपोज मतलब किसी चाइल्ड को हुआ है, 10 या 12 साल के कोई होगा, तो मैम वो मोस्टली हेरिडेटरी रहता है ना, या कुछ ऐसे रह सकता है अदर कॉज?
Yeah, it is mostly hereditary, and even as I said कि tubercular bacilli हमारी body में रहते हैं in a latent format. So if that child having a less immunity, there may be chances that latent tuberculosis can get into the active tuberculosis. So hereditary is one of the factor, one of the risk factor, but other is also the immunity. So even the child who is born as a HIV, okay, if the patient is a HIV positive mother and the child is born, so obviously the child immunity की बहुत कम रहती है, right? So that child may get easily infected by the tuberculosis.
Okay, ma'am.
Yeah. Any other question? ये समझा है सबको tuberculosis?
Yes,
Yes, ma'am.
ma'am.
Okay. Tuberculosis is the frequent questions can ask in your exam also, and it's a frequent disease also you can able to see in your clinic. Okay. So the homeopathy has a good role in the case of the tuberculosis also. हम लोग next time session में देखेंगे what are the different homeopathic medicines you can indicate it in case of the tuberculosis with a case example. यहाँ तक किसी को confusion है?
No, ma'am.
No, ma'am.
So I am ending session here, okay? So read tuberculosis, okay? किसी को कुछ क्वेश्चन नहीं है तो आई एम एंडिंग हियर.
Hello, ma'am.
या
Ma'am, will you share?
योर वॉइस इज ब्रेकिंग. हेलो. Yeah, I will share PPT to the. Yeah, I understand. So I will share the PPT on one person's of your group. Last time also I shared, okay, and uh, please share it to other persons. Then I tell her to share with you all, okay? Because WhatsApp पे नहीं आएगी PPT. It's a very long PPT. So I will share you the YouTube link on a WhatsApp, okay? Yeah. So I'm ending session here, okay? Have a good day all.
Thank you, ma'am.